Professor Bell and classmates. In my video briefing, I will be discussing health professionals' role in quality and safety of care. Quality, as defined by Gitch and Davis, is a dynamic state associated with products, services, people, processes, and environments that meets or exceeds expectations and helps produce superior value. Superior value in the healthcare context means to provide superior quality, superior costs, and superior service. Healthcare is a very competitive industry, as we all know. The ability to consistently provide superior value to customers is vital, and that ability is described by Gitch and Davis as organizational excellence. The concept of total quality comprises all three elements of superior value: quality, cost, and service. The organizations that are able to successfully implement total quality are the ones most likely to achieve organizational excellence. Gitch and Davis, 2016. Medical errors are unfortunately among the top 10 death reasons in the US. More people die from the result of medical errors than people die on the highway. It is estimated that 1 out of every 6 patients is a victim of medical errors that results in health complications or even death. In the YouTube video Safe and High Quality Care, Dr. Harvey Feinberg from the Institute of Medicine discusses how medical errors have become a common problem in our country. Most people have either experienced or know of somebody that medical errors have happened to. Maintaining a safe environment is essential to providing quality of care. The most frequent source of medical error is medication, according to Dr. Feinberg. Medication is a critical issue because it involves administering the right drug to the right person in the right dose and at the right time. Any medication mistake could lead to serious consequences for the patient. Safe and high quality of care. Medical errors can occur due to structural deficiencies, for example, not possessing the best equipment or the most up-to-date hospitals or the right amount of staff. Moral values, which happens when medical staff does not possess high medical standards. Psychological limitations, which is characterized by information overload, stress, exhaustion, emotion, or educational shortcomings, whenever there is a lack of clinical training. The fundamental problem, however, is the system's design. Safe and high quality of care. We must think of healthcare as a system, and we must understand there are currently many challenges when it comes to the design and processes of this system. Healthcare professionals must put the patient at the center of the system. In the news article, Doctors Adapt to Electronic Records, concerns emerge about medical errors. The challenges of avoiding medical errors in a fast-paced environment such as a hospital's emergency department are discussed. The electronic health record has resolved some safety concerns while it created others. The EHR has made it easier and faster to access records and also resolved the issue of misreading a doctor's handwriting, for example. However, it is very easy to make other mistakes with the slip of a mouse. Since the switch to electronic health records occurred, there have been reports written finding that mistakes in the ER, like ordering wrong medications or because of confusing computer displays, have become more common. So the question is, how do you design a system where it is nearly impossible for errors to affect the patient? Dr. Harvey Feinberg affirms the first step to move from error to quality is to recognize the problem. He talks about what has happened in the field of anesthesia in the past few decades. There has been a decrease in deaths caused from anesthesia. In the early 1980s, there was 1 death for every 10,000 patients. Today, that number is 1 for every 200,000. Anesthesiologists were able to minimize mistakes related to anesthesia by simplifying and standardizing equipment and processes with new technology, redesigned machines, standardized practice guidelines, improved training programs, and the creation of hospital safety committees. While medical errors greatly affect the safety of healthcare, Good patterns of communication, coordination, leadership, and teamwork, on the other hand, are behaviors that support quality healthcare. For example, whenever there is a serious accident, the EMTs on the scene will alert the hospital of the incoming trauma and provide information about the patient's injuries and other vital information. When the patient arrives at the ER, the trauma team will assess them, and if emergency surgery is needed, they'll coordinate with the operating room to schedule the surgery as soon as possible. The OR charge nurse, who is the OR leader, will gather a team to arrange for all the instruments and equipment requested by the surgeon to be delivered to the OR. The OR staff will then work together as a team to save that patient's life. Everyone has a specific job, but they all work as a team to provide the best care possible for the patient. Openness of communication with the patient and good quality communication among medical staff will ensure everyone's on the same page and greatly reduce medical errors as well. Coordination and planning, especially in critical situations, will help provide smoother course of treatment and better outcomes for the patient. Leadership behaviors will support effective teamwork. According to Manser, in the journal article, Teamwork and Patient Safety in Dynamic Domains of Healthcare, a Review of Literature, healthcare is intrinsically interdisciplinary, requiring healthcare professionals from different specialties to work in teams. Manser affirms poor coordination among providers at various levels of the organization appear to affect the quality and safety of patient care. Teamwork plays a critical role in the causation and prevention of adverse events, especially in dynamic domains of healthcare such as operating rooms, intensive care, emergency room, trauma, and resuscitation teams. Studies show that teamwork and communication problems are the strongest predictors of surgical errors. Manser, 2009. Besides, the frequency of communication, strength of shared goals, and degree of mutual respect among care providers was found to be associated with improved quality of care, reduced postoperative pain, and improved postoperative functioning, as stated by Manser. In conclusion, in order for us to see an improvement in the safety and quality of care, we must challenge the design and processes in our healthcare system. With the help of technology, we can simplify and standardize processes, making medical errors virtually impossible to occur. Improvements in communication and teamwork among healthcare professionals will positively affect the quality of care we provide. We can all play a part to make healthcare better and safer, producing superior value for our patients. Thank you.